It's shocking to me as a brain doctor. Overnight, this fruit increases the risk of stroke. I have spent 23 years studying the human brain, observing its catastrophic failures, holding it in my hands during surgery, and seeing it on screens. However, nothing forewarned me of what I found concealed in medical papers that are not intended for public consumption by large food businesses. There is a conspiracy of silence surrounding some fruits that are promoted as superfoods that are healthful, but can raise your risk of stroke by up to 47% overnight. I've seen individuals who consumed these fruits on a regular basis wind up in my emergency department with avoidable brain hemorrhages. This concealed threat is unknown to 99% of seniors. You won't believe how many folks who believed a snack was safe wind up in the emergency room, paralyzed and disoriented. You deserve to know which fruits in your refrigerator are ticking time bombs, so I'm breaking my silence tonight. We'll show you the 5 fruits to stay away from in this video. We will also learn how to avoid strokes, which are rarely discussed, and which other fruits to choose, ranked from least to most deadly. And we're going to present the top fruit. It might almost increase your risk of stroke overnight, but most people consume it once a week. Every assertion I'm going to make is supported by actual patient situations from my practice, as well as peer-reviewed scientific research. Tell us where you're viewing from, how old you are, and what fruit you consume the most in the comments section below before we start. Have you ever been concerned that it could not be as healthful as you initially believed? We are reviewing each and every feedback and providing tailored guidance and recommendations. For more videos like this, remember to subscribe to our channel and like this one. Now let's get started without further ado. The 5th, bananas. Bananas' secret risk is shocking because most people believe they are the ideal health food. The issue is that each medium banana has 422 milligrams of potassium, which is too high. Although potassium is necessary for heart health, certain people, especially those over 60 or those using blood pressure medication, may experience severe blood pressure rises when they consume excessive amounts of it. Bananas are harmful due to a very straightforward mechanism. Vasospasm is the term for the fast constriction of blood vessels caused by consuming large amounts of potassium. Mini-strokes or temporary ischemic episodes may result from this abrupt constriction of blood arteries in the brain. According to a 2019 study published in the Journal of Neurological Sciences, which tracked 8,400 persons over 50, those who ate more than 3 bananas per day were 23% more likely to suffer a hemorrhagic stroke. I recall that Margaret, a retired teacher at the age of 67, came to visit me when her left eye suddenly lost its ability to see. She had been eating 2 bananas for breakfast every morning since she thought they were good for her heart. Her potassium levels were alarmingly high at 5.8 millimoles per liter, much over the normal limit, when we performed her blood tests. Due to abnormal heart rhythms brought on by the elevated potassium, tiny clots formed and made their way to her brain. The true risk arises when patients take certain drugs with bananas. The body retains more potassium when using beta blockers, AC inhibitors, and potassium-sparing diuretics. Bananas and other meals high in potassium combine to increase the risk of stroke. Within 3 weeks, Margaret's symptoms were totally gone when we changed her medicine and diet, cutting out bananas and substituting lower potassium fruits like apples. Moderation is the safest course of action if you're a banana lover. To limit absorption, only eat 1 tiny banana every other day and always pair it with protein. Berries, which provide comparable sweetness with a significantly lower potassium level, or apples, which only contain 195 milligrams of potassium, are better substitutes. The secret is to consume potassium in small doses throughout the day rather than all at once. Wait till you learn about the next fruit that brings more people to my emergency room than any other if you believe bananas are a cause for concern. The 4th item is grapes. Despite their seemingly harmless appearance, grapes have a terrible secret. Concentrated amounts of natural sugars found in these little fruits can cause your blood sugar to rise more quickly than candy, causing a metabolic catastrophe that raises your risk of stroke. 23 grams, or about 6 teaspoons, of sugar are found in 1 cup of grapes, and they are quickly absorbed into your system. Glycemic variability is the mechanism by which the stroke link occurs. Your body produces enormous amounts of insulin to make up for a rapid rise in blood sugar. Your blood vessels become inflamed as a result of this insulin spike, increasing the risk of blood clotting. According to a seminal Harvard Medical School study that followed 12,000 individuals for 15 years, those who ate grapes every day were 31% more likely to have an ischemic stroke than those who ate them infrequently. Robert, a 58-year-old accountant who enjoyed munching on grapes at his desk, will always be in my memory. After suffering numbness in his right arm for 20 minutes, he came to my clinic. His MRI revealed several tiny patches of brain injury, known as silent strokes. After consuming grapes, his blood sugar level increased from 95 to 180 milligrams per deciliter in 30 minutes, and an hour later it plummeted to 70 milligrams per deciliter. With some grape varieties, the issue gets even worse. Tyramine, a substance found in red grapes, can cause severe increases in blood pressure in patients on MAO inhibitors, which are antidepressants. Patients who were unaware of the risk have suffered fatal strokes as a result of this interaction. Furthermore, pesticides that build up in the skin and have been connected to a higher risk of stroke in agricultural workers are frequently used extensively on grapes. Eliminating grapes entirely and converting to low glycemic fruits were necessary for Robert's recovery. He needed something sweet and juicy, but without the risky sugar rush, so we substituted cucumber slices and cherry tomatoes for his grape nibbles. His arm numbness never came back, and his subsequent brain tests revealed no new damage. Treating grapes like dessert rather than health food is the safest way to handle them. Limit your intake to 5 or 6 grapes if you must, and always eat them with a meal that includes fat and protein to decrease the absorption of sugar. The fact that individuals frequently eat frozen grapes carelessly and consume significantly more than they realize makes them even more harmful. Following alarming new research, hospitals have begun to remove the next fruit on our list from patient menus. 3rd place, oranges. Vitamin C is essential for blood vessel health, but oranges themselves can cause fatal strokes in susceptible people, making them one of medicine's biggest contradictions. Furanocoumarins, which mix with dozens of drugs and can cause blood pressure to spike within hours of ingestion, are the hazard, not vitamin C. The most startling finding was from a 2020 study that tracked 15,000 patients taking blood pressure drugs and was published in the International Journal of Stroke. Regular orange or orange juice consumption was associated with a 44% increased risk of hemorrhagic stroke. Oranges work by preventing your liver's CYP3A4 enzyme, which breaks down drugs, from working. Medication levels in your blood rise to hazardous levels when this enzyme is inhibited. Even doctors are duped by fruit industry promotion, but Susan, a 71-year-old retired nurse, should have known better. She arrived at my emergency room with a blood pressure measurement of 210/120 and the worst headache she had ever had. While on amlodipine for her hypertension, she had not been consuming fresh orange juice every morning. Her drug levels tripled as a result of the combo, causing a minor brain hemorrhage. However, drug interactions are only the first step. With a pH of 3.5, oranges are extremely acidic, which damages tooth enamel and causes long-term inflammation in the mouth and throat. Through a process known as the oral systemic linkage, this mouth inflammation has been directly associated with an elevated risk of stroke. Plaque forms in the arteries of the brain as a result of bacteria from inflamed gums entering the bloodstream. Another issue with oranges is their sugar concentration. The 17 grams of sugar in one large orange are mostly fructose, which is processed by the liver differently than glucose. Uric acid is a byproduct of the metabolism of fructose, and high uric acid levels are known to cause strokes. According to studies, the risk of stroke is doubled for those with high uric acid compared to those with normal levels. Once Susan's brain hemorrhage subsided, we had to entirely change her diet. Bell peppers, which offer even more vitamin C without the risky interactions, were used in place of oranges. A yellow bell pepper, free of excess fructose and furanocoumarins, has 340 milligrams of vitamin C, while an orange has 70 milligrams. Her blood pressure returned to normal, and subsequent scans revealed that the bleeding had stopped entirely. Oranges should be completely avoided if you are on any medications, particularly blood thinners, blood pressure meds, or statins. When there are safer sources of vitamin C, the risk is just not worth it. Speaking of blood thinners, individuals who were unaware of the fruit's lethal combination with these life-saving drugs have died as a result of it. Grapefruit comes in second. Because grapefruit is so harmful, there are now clear cautions on many drugs not to eat it. But millions of people never read or disregard these warnings. This fruit is up to 10 times more effective than oranges at interfering with the metabolism of medications because it has the greatest quantities of furanocoumarins of any citrus fruit. Drug levels can be changed for up to 72 hours after drinking 1 glass of grapefruit juice. The numbers are horrifying. According to a thorough analysis published in the Canadian Medical Association Journal, there are 85 drugs that have harmful interactions with grapefruit, 43 of which have the potential to be fatal. In particular, grapefruit can raise blood statin levels by up to 1,500%, which increases the risk of stroke by inducing significant muscle breakdown and the production of proteins that clog kidney filters and cause strokes. James, a 64-year-old construction foreman, was treated by me for his elevated cholesterol by using atorvastatin. In an effort to improve her health, his wife had begun to make fresh grapefruit juice. James experienced intense muscle pain and black urine within 2 weeks. His creatine kinase values were 300 times normal at 50,000 units per liter when he arrived at my emergency room. His brain had been hit by several little strokes as a result of the muscle disintegration. The dangers of grapefruit are not limited to medication interactions. Limonoids, which are substances found in grapefruit, block calcium channels in blood vessel walls. Abrupt vasospasms may result from this interference, especially in the brain's tiny blood arteries. Even among those who were not on any drugs, a daily intake of grapefruit raised the risk of stroke by 59%, according to a Japanese study of 20,000 adults. Blood coagulation is also impacted by grapefruit in a number of ways. It first prevents platelet aggregation, which seems advantageous, but it then has a rebound impact, making platelets hyperactive. The ideal environment for both hemorrhagic and ischemic strokes is created by this clotting activity roller coaster. These hazards are exacerbated by the fruit's high potassium level, 340 milligrams per half grapefruit. James needed 6 months of rehabilitation to regain his ability to walk after spending 3 weeks in critical care. We found that the grapefruit produced rhabdomyolysis, or total destruction of muscle tissue, by sharply raising his statin levels. His brain was affected by clots of proteins that were produced from his damaged muscles. For someone on medicine, 0 grapefruit is the only safe amount. Because grapefruit's effects can continue for days and interact with over-the-counter medications like antihistamines, even those who are not taking any prescriptions should exercise extreme caution. Try lemon water instead, which has a comparable flavor without the harmful chemicals, if you like sour citrus flavors. This brings us to the most startling fruit of all, one that the food industry has been promoting as a superfood for years, while neurologists have been lamenting. Pomegranate comes in first. Because it combines several stroke triggers into one seemingly healthy package, pomegranate is at the top of our list. Although this fruit has been heavily promoted as a superfood that is good for your heart, the study shows otherwise. Of all the fruits, pomegranates have the largest concentration of substances that thin the blood, but they also include sugars that encourage clotting, which can cause havoc in your cardiovascular system. The figures are astounding. Regular pomegranate consumption raised the incidence of hemorrhagic stroke in adults over 55 by 67%, according to a 2021 meta-analysis published in Stroke Research and Treatment that looked at 25,000 cases. The process involves substances known as punic allergens that disrupt the metabolism of vitamin K. Pomegranates can cause spontaneous bleeding in the brain because they interfere with the appropriate blood clotting system, which depends on vitamin K. David, a 69-year-old professor, was the epitome of what pomegranate marketing aimed to achieve. He was concerned about his health, worked out frequently, and drank pomegranate juice every day because of its purported antioxidant properties. We found that he had suffered a severe intracerebral hemorrhage when he collapsed during a speech. Despite not taking any blood thinners, his INR, which gauges blood clotting ability, was 4.8. His blood had practically become water due to the pomegranate juice. When you take into account that pomegranates are nearly always eaten as juice, which concentrates their toxic ingredients, the risk increases. 3 whole pomegranates are needed to make 1 cup of pomegranate juice, which has 134 milligrams of punicalagins. For up to 96 hours, this dosage is sufficient to prevent clotting. To make matters worse, commercial pomegranate juice frequently has additional sugars that cause dangerously high blood glucose levels. However, pomegranate danger's relationship to the supplement industry is its most pernicious feature. Due to its purported health benefits, many people who consume pomegranates also take fish oil, turmeric, or ginkgo biloba. When paired with pomegranate, these supplements' blood-thinning qualities combine to produce the ideal environment for brain hemorrhage. In addition to his daily pomegranate juice, David had been taking all 3 vitamins. With 35 milligrams per serving, pomegranates have the highest oxalate content of any fruit. Crystals of oxalates harm blood vessel walls and cause inflammation all over the body. Over time, this ongoing inflammation weakens the blood arteries in the brain, increasing their vulnerability to rupture. Research indicates that, regardless of other variables, a high oxalate intake raises the risk of stroke by 40%. After surviving his brain hemorrhage, David had to withdraw from teaching since he was unable to communicate clearly. We were able to directly link his bleeding to the months-long accumulation of pomegranate juice in his system. He had to completely abstain from all blood-thinning meals and supplements during his recuperation, and even then, his cognitive faculties were never totally restored. One of the biggest lies in the history of nutrition is the promotion of pomegranates as a health food. Vegetables that don't increase your risk of stroke, like spinach or broccoli, are good sources of antioxidants. If you have been eating pomegranates on a regular basis, discuss with your doctor the possibility of having your clotting factors checked and think about quitting right now. After learning about these harmful fruits, you may be wondering if any other fruits are safe to consume. Yes, without a doubt. I'm going to offer the 3 fruits that I personally eat daily and suggest to all of my patients. Numerous studies have demonstrated that frequent consumption of these fruits can lower the risk of stroke by up to 52%. First up, blueberries. The evidence supporting blueberries' superiority in brain health is overwhelming. Anthocyanins, which are found in these tiny berries, actually mend damaged blood arteries and stop new strokes from happening. According to a groundbreaking Harvard research that tracked 93,000 women for 18 years, eating blueberries 3 times a week reduced the risk of stroke by 32%. At the cellular level, the miracle takes place. Each cup of blueberries contains 84 milligrams of anthocyanins, which directly shield neurons from oxidative stress by bridging the blood-brain barrier. With a glycemic index of just 53, blueberries release sugar gradually and continuously without producing harmful spikes, in contrast to the harmful fruits we covered. To prevent exposure to pesticides, I advise eating 1 cup of fresh or frozen blueberries per day, ideally organic. Because freezing breaks down cell walls and increases the availability of the chemicals, frozen blueberries actually contain more anthocyanins. Add them to plain Greek yogurt for a protein-rich, brain-protecting breakfast. Avocados come in second. Although avocados are classified as fruits, their physiological effects differ greatly from those of sugar-filled fruits. They are rich in monounsaturated fats, which enhance blood flow to the brain and lessen inflammation. According to a University of Pennsylvania study, Eating one avocado every day decreased the incidence of stroke in adults over 50 by 45%. Avocados provide 690 milligrams of potassium, but because of their high fiber and fat content, they release it more gradually than bananas. This stops the harmful potassium surges that we talked about earlier. Additionally, they contain lutein, a pigment that selectively builds up in brain tissue and guards against damage from stroke. The recommended daily intake is half an avocado, which offers 10 grams of fiber and aids with blood sugar regulation. I add it to salads or spread it on whole grain toast. Additionally, the good fats aid in the absorption of fat-soluble vitamins from other foods, enhancing their beneficial effects on the brain. Strawberries come in third. When a large European study of 450,000 people revealed that strawberries were the best protective fruit against stroke, researchers were taken aback. Even when other lifestyle characteristics were taken into account, people who ate strawberries twice a week had a 30% decreased risk of stroke. Their special blend of ellagic acid, vitamin C, and folate holds the key. Without the hazardous furanocoumarins present in citrus, 1 cup offers 85 milligrams of vitamin C. Additionally, strawberries contain salicylates, which are naturally occurring aspirin-like molecules that prevent blood clots without the bleeding danger associated with pomegranates. Since ordinary strawberries are routinely sprayed with chemicals, wherever possible, choose organic strawberries. To fully benefit from the fiber's ability to decrease the absorption of sugar, eat them whole rather than juiced. The ideal daily serving is 8 medium strawberries, which will give you the most protection without being overly sweet. Together, these 3 fruits can help shield your brain. I frequently advise my patients to prepare a daily brain bowl that contains all 3, strawberries, blueberries, and avocado slices, with a dash of ground flaxseed on top. Hundreds of my patients have been able to enjoy delicious, fulfilling fruit while lowering their risk of stroke because to this combo. We'd like to hear from you now. Have you or a loved one ever eaten a fruit you believe to be healthful and then developed odd symptoms? How did you figure out what happened? Please leave your thoughts and experiences in the comments section below. Hearing them would be wonderful. Thank you for viewing.